Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching off-ski and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your off-ski exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Okay, so today we're going to go through some questions for a CBT exam. This session is focusing on Part B questions. So, what is meant by the term discriminatory? Choose the correct answer. Ensuring the care decisions are made holistically, treating people differently because of their sexuality, for example, reporting angry colleagues to senior staff, supporting equality for all service users. So the answer for this is treating people differently because of their sexuality, for example. So make sure you've read the question clearly, because I know one of the potential answers, if you're going through quickly and if you're rushing, could be the final answer, supporting equality. But make sure you read the question thoroughly. You've got plenty of time this exam, so read it twice if necessary. You can always flag questions and review them at the end. So let's talk about this. Discriminatory. So this is when you discriminate against someone. So examples of this would be stuff like racism or sexism. Okay? So that's what we're talking about when we use the term discriminating. Okay. When preparing to slide a patient up the bed using a slide sheet, what is the correct verbal cue used by nurses to ensure coordinated movement? 1, 2, 3. Slide on 3. Ready, set, slide, lift and slide. So this is ready, set, slide. So the rationale behind this is, if either of you are standing on other sides of the bed and you've got the slide sheet, if you count 1, 2, 3, some people go on 3 and some people go just after 3. Some people might go on 2, whereas ready, set, slide, you're both going to go on slide. So that is best practice. What is the Sepsis 6 care bundle designed to achieve when implemented within the first hour of recognizing sepsis? To prepare the patient for surgery, to stabilize blood sugar levels, to reduce mortality by delivering 6 key treatments rapidly, to assess pain and mobility levels. So this one, obviously, it is about sepsis. So the Sepsis 6 is like a care bundle, it says, that we have here in the UK, a protocol we use. So it's once you've discovered the patient is septic, within the first hour, you've got to do 6 tasks in order to, provide the best care for them. So it's stuff like giving antibiotics, starting up their fluid, checking their bloods. Okay, so that's what it's talking about. If you haven't heard of the Sepsis 6, just Google it quickly so you have an idea about it for your exam. Okay. Any breach of security requires to be reported to the Information Commissioner's Office within what time frame? 24 hours, 7 days, 14 days, 72 hours. So this one is 72 hours. So within the CBT exam, you will have some questions about like laws and legislations, that kind of thing. I would recommend to study them. Make sure if you've got any mandatory training due now within your current job, to make sure you've done that and it's up to date. Because it mentions a lot about legislations and laws there. Also, it goes over some basic nursing care, just to give you a bit of a refresh. Which of the following statements is true about asthma? Asthma only affects older adults. There is a permanent cure for asthma. Asthma symptoms cannot be controlled. Asthma can start in childhood or adulthood. Any symptoms can be managed with treatment. So it is the last point. It can be started in childhood and it also can be started in adulthood, and symptoms can be managed with treatment. So a good way to remember the answer to this one is, I'm sure you've all come across that kid who's got the inhaler with them at some point. So that's how I remember it. Okay, and good luck with your exam.